Okay, first I would like to argue against her last point that that it has to be in person. No, there's nothing in the law that states that the verbal request has to be made in person. It just states that 2 verbal requests have to be made 15 days apart. They are accepted over the phone or voicemails. Also, when it comes to the second doctor, there is nothing that says that the patient has to have an exam. All that can happen is that the first doctor fax over the patient's medical paperwork and the second doctor signs off on the prognosis. Witnesses. It does not state that it has to be, oh my gosh, what are those people called? They stamp things?
Notarized.
Notarized. It does not say anywhere that the witnesses' signatures have to be notarized. That means any Joe Schmo can forge a signature and fax over the information to the doctor. As for prescriptions, I know firsthand that you can pick up prescriptions. All you need to know is this person's birth date. I do it all the time for work. In regards to individual autonomy, it is not a sufficient justification and is embodied in the safeguards incorporated into the proposals for the legalization, hence having to have multiple professionals' approval of the prescription. Physician-assisted suicide is a slippery slope to euthanasia. In regards to the bag incident, Kevorkian, who was an extreme supporter of physician-assisted suicide, created a machine to kill people by themselves. He even went so far as to inject someone with lethal dose of drugs and was sentenced to jail. A supporter for physician-assisted suicide committed murder because it was easier. Dr. Timothy Quill, who is an expert on the end of life and palliative care, he stated that 1% or fewer deaths would be improved by legalizing physician-assisted suicide. This number is very low and is so low that it does not permit all the abuses that could take place. For example, in the Hastings Center report, Voluntary Active Euthanasia by Dan Brock, who is also a staunch proponent of legalizing physician-assisted suicide, acknowledged that stringent safeguards cannot eliminate the potential for abuses. When it comes to money, it is a big motivator for people to do terrible things. And in a support study, found that 24% of cases of terminally ill patients, their families lost most or all of their savings to medical care costs, and this can encourage people to push for the patient to take to take lethal drugs prescribed by a physician. April stated that we cannot legalize or legislate morality, and yet her teammate was arguing that we can. So there's that. Also, she stated that physician-assisted suicide is to help relieve depression of patients who are terminally ill. That is not the goal of Oregon's model. It is to relieve pain and suffering only, not to end life quicker. That's it.